When it comes to the question of what prophylaxis is recommended in patients with myeloma, my answer is very clear. Every patient should be vaccinated. Every patient should be vaccinated against influenza every year, his caregivers and his partners. That would reduce, of course, probably even mortality. The problem with vaccination is manifold because the response to vaccination is sometimes, often suboptimal. So you should consider re-vaccinating your patients, particularly against influenza. But all your patients should also be vaccinated against pneumococci. And you can think about vaccination against Haemophilus influenza. You should have a look at whether the patient has been exposed to hepatitis B or A, and because hepatitis B infection is a problem, is a risk, because when patients are on proteasome inhibitors, there may be reactivation. So vaccination is important. And then the question pops up, what can we do against bacterial infection, the risk? So antibiotics, prophylaxis with antibiotics is not recommended in every patient. It's recommended in high-risk groups. So what are patients who have a higher risk for infections? Usually elderly patients, patients with previous frequent episodes of bacterial infections before treatment, patients with full-blown disease, which is not controlled. So this is the risk group where you may consider antibacterial prophylaxis, for instance, with a fluoroquinolone, with Bactrim, or with amoxicillin. So you provide this, administer this prophylaxis as long as the patient has full-blown disease, but when a patient is in remission, of course, you stop. What else? Of course, there are few patients who need prophylaxis against fungi, but that is only in those with transplant or in those with high-dose glucocorticosteroids, which is rare these days. So that is the prophylaxis.